Hey guys, it's Monday night. Welcome to Monday Night Spark. In tonight's episode, we are going to be talking about routine, self-mobility, and soft tissue care for you as a runner. So do you get tightness in your muscles, or you just feel those aches and pains during your running? Are you a person who knows you should be stretching and you've had some tightness or soft tissue issues before? Maybe you had tendonitis, maybe you pulled a hamstring, maybe you pulled a quad, you felt like your quad was tight, you had some Achilles pain, and you're wondering, should you be stretching? Or you stretch out your legs and you think that's going to kind of help cure your problem and you're going to get better from that. So tonight, we're going to be answering your questions about routine, self-mobility, soft tissue care. These are going to be the specific kind of strategies that we're going to be talking about to help keep you healthy so you can be able to train for those spring races and get some PRs and stay healthy all along the way. Some of the common questions that we're going to address is, should you be foam rolling? So should you be using one of these guys? Right? Should we be using one of these guys? This is going to be like show and tell tonight. We're going to bring it with a little show and tell style. I'm going to be showing you multiple tools that you can use to keep you healthy. We're going to be talking about stretching, how much, when, what types. We're going to get into that. We'll get into some of the tools that I brought out before. So the metal tools, what's the Graston technique. We'll even talk a little dry needling. I'll show you what a dry needle, what a needle looks like, and see if that could help you out. So I know there's a bunch of new people in the group. So for those of you that don't know me, you haven't seen me yet, I'm Dr. Dwayne Scotty. I'm a physical therapist with Spark Physical Therapy, where we help runners stay on the pavement doing what they love without pain, rest, or multiple trips to the doctors. So it is the first Monday, little Super Bowl post Monday. So for those of you that are jumping on here on the live, I could just see kind of some people jumping on here. Just type in live into the comment box so I know you're here. And then if you're watching this on the replay, then just type in replay into the comment box. For some reason, I'm not able to see anyone coming on. So not sure why that is. All right, here we go. Now I can see some people jumping on here. Jess, thank you for jumping on. Marva, good to see you. Thanks for jumping on. Keith, how are you? Tracy, thank you. Marva's in. All right. Marva's in, and Marva's in the program as well. So we're pumped to have you, Marva. Signed up today. For those of you that did not hear yet, and you haven't seen the fourth probably announcement or post, I'm very, very excited about the Cheshire Half Marathon program. So for those of you who have not checked out the program and you're looking to actually take your half marathon goals to the next level and you're looking to get a PR, you've tried it before, you're trying to beat a time, we have a program for you. Or if you're thinking about taking that first step toward doing that half marathon, for your first half marathon. I did a live with my wife a month ago when she ran her first half marathon, the Disney half, and I know that video resonated with a lot of you guys. So those that are running your first half marathon, if you have a half marathon goal, just type it in the comment box, whether it's a PR or it's your first half marathon, or you're thinking maybe you should run your first half marathon. So if you're considering, drop it into the comment box. I would love to hear it and love to be able to help more of you guys. And Doug, thank you for jumping on here. I appreciate it. Marv is here on the live. Keith's here on the live. Sundar's here on the live. Hopefully you're recovering well from the king of pain, Sundar. It looks like that probably lived up to its name. I would imagine that race. I know a bunch of you guys in the group ran the race, I believe. I saw some comments. I know Sundar shared the race prior to the race. I would love to hear how it actually was and how sore your quads are today, Sundar. Let us know in the comment box. But if you are looking to take that next level, we have a program for you. Coach Clay Tebbets and I from Multi Sports Academy and Team Mossman have put together a program that can help you reach that goal. And it's really built upon being there with you every step of the way. We have a 10-week program. I am super excited. This is almost like a beta launch because it's super, super cheap that we're rolling this out for what we're going to be giving in terms of value. And we're going to be with you every step of the way with an online calendar for training, I'm going to be dropping specific exercises you should be doing along the way to keep you healthy. So you're doing the right exercises when, in terms of your training. And then we're going to be doing the live group runs, keep you accountable, meet up. We're going to be meeting up. So there's been a couple of questions that people have had. Sunday mornings at 8 a.m. We'll be hitting the trail at least 8:15. So we're going to be right on the Farmington Canal line, right in Hamden, going into Cheshire. So kind of the same terrain as the race will be. And Cheshire for me is definitely got a little place right here. It was the site of my first half marathon, and I've run it 5 times. And I'm really excited to be able to run it this year. And I want to take as many of you guys with us, right? And be able to win in Cheshire, okay? So if you want to win in Cheshire, just type in win into the comment box. And I would love to either jump on a call with you, or if you have any questions about the program, please send me a message in Messenger, and I'll be happy to answer it. I've had a couple of questions so far, and I would love to be able to answer any questions that you have. So Stephanie says she has a goal to maintain 10-minute miles throughout the run. Nice. That's a great goal, Stephanie. That is definitely in reach for you. And let us know, how many races have you run so far? Have you done a half marathon before? And, what your kind of past times were. And we can kind of talk about that a little bit. But guys, as we're getting into tonight's topic, we're going to be talking about the 4th kind of tip, healthy tip to keep you running, right? This is our Spark Blueprint. And this is the 5th week in a row, been going live. Tonight is a little later, so thank you for your patience. Schedule's been really, really busy. I'm trying to help as many of you guys as I can one-on-one, and I had to just get this person in, and so I needed to help them out. So I appreciate your patience in waiting to jump on at 8:30. Next week will probably be the same time, 8:30 as well. So just a little programming note. But thank you for those of you who are on the live, and thank you for those of you who are watching this replay. I appreciate you. And Steve, thank you for jumping on here. So let's get into tonight's topic, soft tissue care, 4th tip in our Spark Blueprint. The first 3 weeks, we talked about strength training to run. We talked about jump training to run in the 2nd week. And last week's episode, we talked about weight-bearing exercises and training on one leg. So if you haven't heard any of those, I suggest you go back, go to the Monday Night Spark topic tab on your phone. If you go to our homepage in the Healthy Runner Facebook group, scroll to the left. You're going to find a tab that says topics. Hit the topics button. Then you're going to be able to click Monday Night Spark. You'll find all these live in-depth trainings right there. You'll also find other topics. If you're looking for strengthening exercises, stretching exercises, nutrition, motivation, go to the topic that you like. I've really categorized everything within the group. So those of you that are watching this on our YouTube channel, on our Spark Your Training YouTube channel, then head over to Facebook, check out our Healthy Runner group. You're going to find that's kind of like our home base where you're going to find everything right there. So this is our 4th tip, really get into how do we take care of our muscles. So we talked about in those first 3 episodes that our muscles are contracting repetitively over and over again, every single step that we take on the pavement, right? So if you have ever gone for a long run that was new to you, you're doing some new mileage, or you're adding in speed work into your training, then let me know in the comment box if you've ever been sore or your muscles have felt tight. So who has felt that their muscles are tight? I want to know, guys, in the comment box. So here we are tonight. I want to interact as much as with you guys. So today was actually my first lecture for my DPT students at Quinnipiac, and that was, there's like 95 students. This class is a huge class, and I was lecturing to them, and they're college students, so they don't interact a whole lot. So I want you guys to interact as much as possible because I already did a lot of talking today. So I want to be able to kind of interact and answer your questions that you have. And the other question I have for you is if you have had any soft tissue injuries, whether it's a tendonitis, whether it's a tight muscle, whether or not it's a muscle strain, let me know where it was. So let me know what muscle. Was it the quads? Was it the hamstrings? Do you have tight calves? Do you have plantar fasciitis? Do you have Achilles pain? Let's find out kind of where the group's at right now, and I can tailor tonight's topic to you guys because you guys are here on the live. All right. So Marva says that she is feeling tight. Let me know what muscles that you're feeling tight, Marva. Right. So let me pull out my muscle guy here, give you guys a little anatomy review. front of the thigh. We got our quad muscles. We're going to be talking about the quads. Back of the thigh. We have our hamstring muscles. So your hamstrings, you actually have 3 hamstring muscles. So you have your lateral hamstring on the outside. You have your medial hamstring. You got 2 of those guys that go on the inside part of your leg. And then you got the back of the knee. I don't know if any of you guys ever got that little Baker cyst, or you've been told you have a Baker cyst. You get some pain in the back part of the knee that occurs right in this little hole in the knee there. We call it the popliteal fossa. And then we got our calves down here. So you got the big calf muscles, and then we got our Achilles tendon. So this is kind of what we're going to be talking about, is how do we take care of these guys? What do we do? How can we take care of them? So let's talk about first what you may go to a medical provider for. And then I'm going to give you guys the actionable strategies that you can do on your own. So Doug said he's got high, tight hamstrings. And so Doug, have you ever felt pain in the back part of your sitting bone, like right on top of your butt area, like that part of the hamstring where the tendon is? So very common in runners. I see a lot of runners with this condition. You'll have pain with sitting. You'll have pain probably in mid part of your run, or as you increase in mileage, especially if you do a lot of hill work. That's where you'll feel your pain. I felt that pain before. I think I told this story before, but if you don't remember, I did have hip surgery 8 years ago, and that's actually how I started running, right? So I had hip surgery, a hip arthroscopy for a labral tear. After that surgery, I had some muscle imbalances, which is very normal. And most people who have surgery wind up having muscle imbalances after their surgery. And that's why it's so important to do your strengthening exercises in recovering from your surgery. And I started having hamstring pain because of the muscle imbalances once I started running. Because remember, I was a novice runner. I never ran before in my life. So that was the first time I started running. And just like many of you, you get out there, you're like super excited, you're super pumped, and you probably do a little bit too much. So started feeling pain in the top of the hamstring area. So we did a whole live on hamstring injuries. So Doug, I would definitely check that out if that is you. And I think it is. So Doug says yes. And Marva says sometimes the calves. So we'll get into that. And Sundar says glutes, or the upper hamstrings and knees. So yeah, upper hamstrings and the glute. Yeah, with those hills, Sundar, holy cow. Yeah, so the glutes and your hamstrings were definitely working going uphill. So it's interesting. I guess there wasn't a lot of downhill where it didn't get your quads, but the glutes and the hamstrings. So this will pertain to you, Doug. It will pertain to you, Sundar, is rolling top of the hamstring muscle belly itself will be beneficial. What are some of the things that I work on with some of my runners that I see in the clinic? In my clinic at Spark Physical Therapy, one of the things that actually works out really well for the hamstring muscle is what we call dry needling. So dry needling is the same needle as acupuncture needles. So this is the actual needle right here. I don't know if you guys can see. It's in a plastic tube right here, but it's super thin. We call this a monofilament needle. So I'm actually going to take this one out. So here is the needle. This one is a little longer. So this, I would maybe use this on a smaller hamstring if you were very thin, but this is going to go through the hamstring muscle. The hamstring muscle is pretty thick muscle. We do have longer needles. So for my male patients, usually hamstrings, I'll go a little bit longer needle, but it's a very thin needle, as you can see. So it's 1/10 the diameter of a typical syringe. So the one that you would get your like flu injection or any other shots, it's 1/10 the diameter of that. So with these needles, my clients don't even feel them go in. So they look a lot scarier, I guess, than they are, but you really don't feel them because they're super skinny. But what the needle's nice and it's able to do is we can actually go into the cross section of the muscle where our hands can't get to, or your foam roller definitely cannot get to, is we can go right through the muscle down to the bone. So if there's a trigger point in the muscle, so a trigger point is a tight, taut band within the muscle that's irritable when we palpate it. So when we kind of palpate along the muscle, we can feel a taut area. I feel that band's taut, and then it may refer pain elsewhere. And if it refers pain elsewhere, we call that an active trigger point. So we've had a bunch of runners where I'll poke at, let's say, their hamstring area, and they might feel it into the foot. Or the best one is even the side hip muscles, right? That gluteus medius muscle, where in the side hip muscles, and this is actually if you have trochanteric bursitis or have been told you have trochanteric bursitis, most likely it's a tendon issue with your gluteus medius muscle. And I actually was just talking to a runner today on the phone about that. There are trigger points in that gluteus medius muscle because remember that muscle's firing every step that you take as a runner to stabilize your pelvis. We talked about that last week in our weight bearing live. That muscle has trigger points in it. It's not firing correctly. So the needle is able to go down deep into the muscle and just shut that trigger point off. So if we can get that trigger point to shut off, then we work our other soft tissue techniques, and then we work on working the contraction of the muscle. So it can be better there. So Jackie, thank you so much for jumping on here. Morgan's on. Nice to see you. Stephanie, nice to see you as well. Glad that you made the live, Stephanie. Thank you so much. Cindy, so good to see you. Marissa, thank you for joining. And Stephanie says that you ran a half last March, finished in 2:35, ran 10K in November, averaged 9:23 per mile, ran 10 miles January, average of 10:48. After about mile 8, she averaged 22 miles per week. She has pain in her left IT band after mile 8 on your long runs. All right, Stephanie, thank you so much for the details. And I definitely think that the 10-minute pace is doable for you. It sounds very realistic based upon what you have there. And thank you for sharing that. Honestly, that's very helpful. And this will actually be important for next week's live, guys. Don't miss it because it's our 5th tip. We're going to get into proper training and training smart with your head as you're ramping up your training and being consistent with your training. So Stephanie, it sounds like you did a great little synopsis here. I like it. We can get into the training specifics next week, but I do think the 10-minute pace is definitely doable. And as far as that IT band, I'd love to jump on a call with you, honestly, if you want to talk about that. I'm not sure if you're local at all, but see if you should be getting some local help regarding that, because you should. And a lot of what I just talked about, that gluteus medius muscle, it's all about that in getting IT band syndrome better. All right. Carolyn, thank you so much for jumping on here on the live. So that is dry needling. Dry needling can be used for decreasing pain and treating trigger points. So that's what physical therapists use dry needling. So I get the common question of, is dry needling acupuncture? No, it is not acupuncture. Do we use the same tool? Yes, we do. We use the same needle, but our philosophy and our theoretical model that we use it for is to treat musculoskeletal pain. So I'm still using the model that I've learned physical therapy in within the medical model. An acupuncturist may use the same exact needle, but they're doing acupuncture because they're treating the Eastern medicine philosophy and theoretical model. So they're maybe restoring chi, energy levels throughout the body. They may put a needle in your hamstring, but they're actually trying to impact an area further away from the body, right? Or they're putting a needle in your foot to impact your headaches, or treating allergies, or treating, right? So there are different treatments of acupuncture that is out of my scope of practice that I don't utilize. I use it to treat muscles. I diagnose you with IT band syndrome, and you have a trigger point in your gluteus medius muscle, and your gluteus medius muscle is weak. So we treat it with dry needling to reset that muscle, to allow us to kind of open up this window of opportunity to now work that muscle and strengthen that muscle. So I hope that dry needling hopefully that was helpful for you guys. So I've come into a lot of contact with people and they're not sure what dry needling is. So I figured I'd kind of drop that here on the live to let you know what dry needling is about. So Jessica says she ran her first half marathon in December and felt great until she had lateral knee pain that hit me at mile 11 and killed. So Jessica, you're describing that IT band syndrome again. So right on the outside part of your knee. So we just talked about that. It really starts up at the hips. The hips don't lie, right? Shakira showed that last night. What do you guys think about that? Seriously, what do you think about the halftime show? Let me know in the comment box. I want to know what you guys thought about the halftime show. I'm not going to tell you my feelings until the end. It seems that it's been a little controversial, perhaps. Let me know if you liked the halftime show or you did not like the halftime show yesterday at the Super Bowl. So Jessica did her last 2 miles and IT band syndrome. Yes, sad emoji. So the good thing is, Jess, this will get better. I actually did an article and a live on IT band syndrome, as well as guested in the Run Buzz podcast, which Steve Carmichael has a great article on exactly explaining what IT band syndrome is, and I gave some good actionable tips. So you'll definitely want to check out that article. If you just put in the comment box IT band article, I will just copy and paste the link for you. I have it handy right in my notes section. Like to keep things organized. So let me know and I'll be happy. So Stephanie says, LOL, Shakira. So Marva says, great. Stephanie says, a little much. And Marva liked, and Jessica said that was a good podcast. Oh, cool. Nice. So she already checked out the podcast. So I'm assuming you referred to the podcast episode I did with Steve, but it is a great podcast. Otherwise, I listen to it all the time. So yeah, support Steve's podcast, the Run Buzz podcast. And Stephanie says she missed seeing Shakira perform. She'll say that. I thought J-Lo's costume choices weren't all that flattering. And yeah, we'll drop you that article there, Jessica. All right, so dry needling is one technique. It is pretty much the most invasive technique, right? So that might not be a place I start when I'm working with someone one-on-one. So one place that I might start out with is with these guys. So these metal instruments, you may have heard about the Graston technique. So that was the course that I took, and I used the Graston instruments for a while. And then I upgraded to these instruments, which are called Fibroblaster. And I like these actually a lot better. So these are the ones I utilize. I have two others. They're different shapes. So if you notice, they have different curves to them, depending upon the muscle that you're treating. And so for instance, I might use this flatter area. I might get into a calf muscle where some people call it scraping, right? So we're kind of moving the fascia of the muscle and then getting a little deeper into the muscle. So one misconception with this technique is that you need to bruise in order to actually stimulate healing. That's actually not true. That's a misconception. And you wind up being very sore and very painful after it. So if you've ever had the Graston technique or any of these instruments, these tools, and you've been told that you need to bruise and kind of show some bleeding and petechia, that's actually not true. In fact, if you release the outermost layer of the tissue right under your skin, there's the fascia, we call that. And then underneath the fascia is like the saran wrap of your muscles. And then you want to get into the muscle. So you got to start lightly, basically, with pressure, and then gradually build into going deeper. So that's like, anyone ever get like a deep tissue massage and they're like getting right in there and you're like writhing in pain? If that's ever been you, just type in deep tissue massage, because I know that's been me a couple times. And it's basically telling you that your nervous system is not ready for that much pressure. And that's why it's so important for you to give feedback to your massage therapist, your PT, your body work expert, whoever you're working with, is to give them feedback, because you should kind of start out by loosening and getting that nervous system ready for them to go a little bit deeper into that area. All right, but you can utilize these tools, and I'll utilize this as a soft tissue technique where I am manually doing different strokes. So we can do like sweeping or scanning the calf muscle, and I'm feeling for any tightness that I feel there, and then I will release. And there's different strokes and there's different swivel patterns. So I'd take like this guy and I would do a little side to side action. We can swivel, we can pivot, we can pin and stretch. So there's all these different techniques that we take in coursework, and then we combine it with active motion. So we get that muscle moving. So it's just a little bit more effective way to get into that muscle than what you could probably do with a self technique. So those are two techniques that I find very helpful for the runners that I work with, is dry needling, and we call this instrument assisted soft tissue mobilization or massage, or IASTM. The most popular one, especially around here in the East Coast, is the Graston technique and the Graston tools that you will hear about. But there are certainly others that it's kind of regional dependent, depending on where you live in the country, that you'll see. So if anyone's had the Graston technique, just type in Graston into the comment box. I'm kind of curious to see how many people have had that. So Marvin says deep tissue massage. And Stephanie says, yes, those look like torture devices. Yes, Stephanie, I get that a lot. And I forget sometimes. I'll have these out on my little table when I'm meeting with someone for the first time. And sometimes it's not a great first impression, because people are thinking like, what is this guy going to do? These torture devices. So they come in these nice little handy things. So I try to keep them in there and kind of hidden. until I explain exactly what they are, because they do look worse. They actually feel very good. So for those of you that have had that before, let us know in the comment box and let us know if it felt good, just so you can dispel any myths or misconceptions. But those that I have treated with these feel a lot better, a lot looser after it. Their muscles. Yeah, J-Lo, Doug says J-Lo looks great for 50. Absolutely, I would agree. And all right, so let's get into the third thing I want to talk about is some self-mobility that you can do either with one of these guys. So you can use one of these sticks, these rollers, right? You can do this right over your thigh, right over your muscle. You can roll out, or you can use your friendly foam roller. If you guys saw the live that I did of myself this morning in the gym, I like to use the rumble roller. This is actually my daughter's. All right, we got a little Scotty on the end here. She's the gymnast. And this is hers here. So they make them softer. So foam rolling, guys, the big thing here, it doesn't need to be extremely painful. So don't kill yourself. You need to really honestly warm up to foam rolling. So you shouldn't be writhing in pain, and it shouldn't be like torture doing your foam rolling, because if it is, then you should just honestly loosen up or lessen the amount of resistance of your foam roller. So don't use the hard ones. You got to build up. So I didn't start with the black rumble roller that's in my living room right now. I worked up to that, and that's the little nodules, the little knobs in there. I love that though. Start out lighter. You don't need to, and a lot of my clients, they'll start out with more of the softer surface, and then maybe go to like the black hard ones, which are a little bit more firm foam material, and then work up to the ones with the knobs, PVC pipe. You can kind of get really aggressive. So Jessica says she uses the rolling pin thing. Just recently bought a rolling pin thing. Stephanie says that she loves it, and so does Jess. All right, cool. Yeah, these work out really good for races, by the way, because it's really hard to, you're going to hop down in the parking lot and like start rolling and put your hands on the cement or in the grass. You can, I guess, but these work out a lot better. I just pop them in my car, and usually after I do my little warm-up jog, after I loosen up, you do a little rolling, put your foot up on your seat, do a little hamstring rolling. That works out well. You can roll your quads, you can roll your calves, and then they're great post-race as well. So Marva says that she has the rolling pin and foam rolling as well. So awesome. Thank you guys so much. If anyone has any questions, please drop them in the comment box. I would love to answer your question, because I could talk about the stuff all night, and you guys don't want to hear me all night. All right, trust me. I lecture on all of these topics to our PT students, so we can get into research. We can like get really crazy. But let me know what questions you have and what you want me to answer as we go along. But kind of rolling pin or foam rolling, let's talk about what it does, what it doesn't do. So foam rolling, you're not actually stretching muscle. You're not actually breaking up scar tissue. I'm sorry if you've been told that in the past. You're not doing that. What are you doing? You're feeling better. It usually feels better if you foam roll. How many people have felt better after they foam roll? And actually, I'm wondering if I can do this as we are going live here. I'm going to actually add my own comment in for the first time ever. And I'm going to say I feel better, because I certainly know I feel better. And we'll see if that, there we go. Nice. I just commented on my own live. All right. First time I ever did that. We've been doing these lives for we're almost coming up on a year now, guys. Consistently every week, been here for you guys, really kind of getting into the community. I was talking to my PT students about that. Today is we have to get into the community a little bit more. And this has been one way that I've been able to do that, and one platform that I've been able to help so many of you and be able to educate. Hopefully you've learned a little something along the way, but that was the first time I ever commented on the own live. But I know I feel better after I foam roll. So let me go first. When should you foam roll? So foam rolling, I highly recommend for you runners to do before your runs, more to activate your muscles, believe it or not. So you are kind of warming them up a little bit, especially in the winter, guys, right? So if you're going to go right outside and, it's a little chilly, weather's been good, fingers crossed. Let's keep February warm, please. We've been very lucky, very lucky. We had a great January. This is like the best January I could ever remember. So hopefully February stays that way. But foam rolling to loosen up your muscles, get the blood flow in there, warm them up, and honestly activate your nervous system. So you're really activating your nervous system, turning on some of those muscles. So then you're going to follow that up with your muscle activation exercises that we talked about in the strength training to run live. So you're going to activate those hip external rotator muscles, your hip abductors, your glutes, your quads, right? Calf muscles. So those are the 5 muscles we talked about. You're going to activate those muscles. So I like to foam roll them first and then combine foam rolling with active motion. So active motion with the foam rolling. Good example, I guess, probably most popular video that I wind up giving my runners that I work with is, because such a common problem, is the calf, tight calves. And especially if you have Achilles pain, plantar fasciitis, that's a common thing that I find is I have a good self-recipe. I kind of made it up myself, but it is based upon the course that I went to with the instruments. So one of the strokes that we do with the instruments is to combine getting into the soft tissue with active motion. So you're moving the muscle over the instrument. So I just kind of tried, hey, why can't I move the muscle when I foam roll? Sorry, guys, been doing a lot of talking today. So had to grab a little sip of water there. Why can't we do that over the foam roll? So I really like to do foam rolling the calf muscle in a couple of different spots. There's usually a trigger point, tightness on the outside part of the muscle belly. So what you're going to do is you're going to turn your toe out when you roll to get the outside muscle, turn your toe in to get the inside muscle, and then release this area. See this, guys? This is where your muscle connects to your Achilles tendon. We call this area right here the musculotendinous junction. It's basically where the muscle connects to the tendon. It can be very tight in this area. It can be very restricted. So I like to pin the foam roller right there and use this area to do my active motion where I'm pointing and flexing my ankle as I roll over. If you guys want the video of that specific foam roll exercise, just type in calf foam rolling into the comment box, and I will be happy to just drop the link for you guys so you don't have to find it on the YouTube channel, because we have a lot of videos on there now. We're like literally almost up to 100 videos just meant for runners. I just looked at that the other day. We're at like 90 something. So we're going to be at 100 videos soon. Hopefully you guys checked out the YouTube channel, spark your training into the search box, consider subscribing, so then you'll be able to get a little notification. Or if you subscribe, but then you got to hit the little bell, and then you'll get notifications whenever I do drop a new exercise in there, as well as you can catch the replay of all of these lives, the live trainings we do on Monday night on the YouTube channel. So you just go to the Spark Live playlist. So I have everything organized by playlist, guys, on the YouTube channels. Check it out if you haven't checked it out yet. And those of you who are watching this on YouTube, thank you so much for watching. And check out the Facebook group and soon to be podcast, right? So we got the podcast coming out soon, guys. Healthy Runner Podcast. I've been working on it. We got 4 episodes recorded. I'm super pumped. It's been a very busy 2020 with everything going on, but it's very, very exciting. And I cannot wait for the podcast to launch. And hopefully many of you guys, our community, will be able to listen to some of these in your earbuds when you are running, because I'm a big podcast listener while I run, especially on the easy runs and these long runs. So if you guys are excited about the podcast, just type a podcast into the comment box. I want to see how many people will hopefully be subscribing to the podcast once we launch it. So we talked about calf foam rolling. We talked about foam rolling before your runs. And then I would recommend, if you have time, guys, so let's be honest here. Like, we're all busy. We're all working. We all have kids. We have like 50 million obligations, activities running around. Like, it's hard enough to get our runs in and our workouts, right? But if you have time, do a little rolling after your runs. Especially, I would recommend your long runs to get that rolling in. So that should be helpful for you. All right. So before, maybe after, you're stimulating your nervous system. You're dampening some of those responses from your brain to the muscles that are keeping them tight. You're going to feel a lot looser afterwards. All right. Are we really breaking up scar tissue? No, we're not. I think that's probably all I wanted to say about foam rolling, but it's a great self-mobility technique you can do on your own, in your house, in your living room, like I do, in the gym, like I did this morning. So before every workout, I'm on that foam roller, just kind of loosening up a little bit. So let's get into probably the most common thing you all have been told that you need to do as a runner. How many of you that are on here right now? So we got 8 people on here right now. How many of you have been told that you need to stretch? So just type in stretch into the comment box. I want to see how many of you have been told that you should be stretching as a runner. So Keith's excited about the podcast. Marva's excited about the podcast. So Stephanie, thank you so much. Awesome. I'm glad that you three will be the first 3 subscribers. Okay. Once I announce that podcast drop and the launch, I want to see you guys subscribing first. I don't even think I could see who the subscribers are, but hopefully you guys will be the first 3 subscribers. So let's get into stretching. Stretching. So I don't know where to go with this. I don't know where I should start. I think I'm going to start. Let's do this. Okay, let's talk about what stretching is and the types of stretching and when you should be stretching as a runner. So guys, I didn't really, honestly, I've been so busy with all these projects going on the weekends and the girls' activities. We had volleyball tournaments. We had dance rehearsals on stage. We had podcast recordings. We had planning. We had a lot of things. I couldn't even plan for this. I like to, honestly, be a little bit more structured and planned. So hopefully this is coming out okay. But this is all coming from the top of my head, kind of, because this is what I do, right? This is what I do is work with runners, and this is the type of stuff that we work on. So let's talk about this stretching first. So let's get into what stretching is. So stretching is elongating your muscles, right? Improving your muscle length. And that's traditionally what stretching has been done. We have different tests that we can do to assess your muscle length, whether or not you have tight hamstrings, whether or not you have tight calves. When we do a one-on-one assessment, I evaluate those things. If you have tight hip flexors, you have a sitting job all day long, and you've been sitting for 20 or 30 years at your cubicle in your cube, then you most likely have tight hip flexors, especially if you're a runner, right? That's a common pattern I see. And do you have low back pain? Those are like things that kind of go hand in hand, right? Maybe your hamstrings are super tight because you sit a lot as well, or you've always felt like you had tight hamstrings. So there are tests to assess your muscle length, and then there are stretches to improve muscle length. We do know that stretching can improve muscle length. So there's 2 different types of stretching I want you to think about. We have static stretching, which is holding, which is probably what you've thought of traditionally as holding a stretch 30 to 60 seconds. So you're going to sit there, you're going to hold the stretch 30 to 60 seconds. We call it static stretching. Maybe you repeat it 3 to 5 times. Then we also have dynamic stretching or active stretching, where now you're actively moving an area. So for instance, if you guys ever had elbow pain, and maybe you work at a computer all day and you have pain with gripping and turning doorknobs, and I would maybe give you a static stretch of stretching your wrist extensors out, right? This is tennis elbow, stretching like this. And I would say hold 30 to 60 seconds. That'd be static. Or I can have you do a dynamic stretch, and I could say you're going to bring your wrist down. Let's try to get my wrist in the picture here. Here, and then I'm going to have you bring it up and down and up and down and up. That would be an active or dynamic stretch. Typically, what we recommend is that runners definitely do not static stretch before activity. And this is all athletes, and this has changed since I became a PT 17 years ago. We used to do a lot of static stretching. Now we know better. Static stretching is done after activity to improve muscle length. So we know that it will improve muscle length. So after your runs, that's when you want to do your static stretching. Before your runs, you need to stretch dynamically or active. And for those of you that are running Cheshire, definitely want to keep an eye out. We'll definitely do an event for a little Spark warm-up. So those of you that are watching, or those of you watching on the replay, if you've ever participated in a Spark warm-up at a road race, just type in Spark warm-up and let us know if you found it beneficial. So my goal, and I just started that last year, that actually started at, I was running Fairfield, and I was like, hey, anyone running Fairfield? I just put it on Facebook on my personal page. It was like, anyone running Fairfield, like, I'm going to be warming up. Do you want to warm up together? And that had literally had 2 people who came, but they found it very beneficial. So I was like, okay, this is cool. Maybe I can help out other runners. And then we did it for the sea leg shuffle, the 10 miler in Guilford over the summer. And we had probably like 8 to 10 people. Actually, we had more than that. It was like 12, I think, or 14. And then New Haven, we had a big group. That was awesome in New Haven. That was fun. And so we did a dynamic warm. So that's just something I do now at road races that I'm at. I like to just get a group of people together. Let's do a dynamic warm up, make an event. I'll post an event for the Cheshire Road Race. Certainly, we'll all kind of go for a jog, get the blood flow going, follow it up with some dynamic stretching, active warm up. So if you want if you actually want a YouTube link, so put in dynamic stretching video into the comment box if you want me to send you what I do at the Spark warm-ups at road races and what I like to do before my runs, especially when you're really taxing and you're doing speed work. You need to do some really good dynamic warm-up, guys, so you don't pull a hammy, you don't pull your calf muscle when you are running. So so Doug said he's on the podcast. Lori, thank you so much for jumping on here. Deborah Scotty jumped on here, and she's not even in the house right now. So she is picking up my daughter right now from gymnastics, and she jumped on live. So how you doing? And Marva said Spark warm-up. She was at the New Haven half, and it was great. Yes, Marva, that's where we met for the first time. So, yes, that was very exciting. I do remember that. And so dynamic active stretching before your runs. All right, you got to prime the body, get it moving. You add a little bit of stretch, and then you relax. So you're really moving your muscles actively to get you ready for running. So that is types of stretches: dynamic, active, or static stretching. So now let's get into dynamic stretching as far as prescription. So how much should you do? How long do you hold? Dynamic stretching should be held for just a couple seconds, 2 to 5 seconds tops. All right. Static stretching, like I said before, 30 to 60 seconds, repeat it 3 to 5 times. So now what works best, and actually just did this. So next week, guys, I'm super excited, heading out to Denver for the first time ever, presenting at our national conference. This is like huge. It's called Combined Sections Meeting, CSM. There's going to be 30,000 PTs in one city. So I've been going the last 3 or 4 years. This is my first time actually presenting, and I'm presenting 2 presentations, which I'm super excited about. One is my research, and that's my research in gymnastics medicine. And this other presentation that I'm giving is actually treating the gymnast shoulder. And one of the topics I'm going to be talking about is stretching. And I actually just did a thorough literature review on this. And there's a systematic review, which basically reviews all the high quality research in the field and evidence. And the biggest take home message from looking at all this research is that stretching does work at improving muscle length. The best way to stretch is to not do like 1 or 2 times a week for like a long session, do like an hour stretching session. The best way to actually improve your muscle length is to actually do 5 minutes a day frequently for at least 5 times a week. And that's really looking at one muscle group. So think about more frequently stretching throughout your week, as opposed to like one day, Sundays are going to be like my stretch day, and I'm just going to stretch like for an hour on Sundays. Think about incorporating your stretching in little bits. So like after my workouts, I pretty much stretch for like 5 or 10 minutes after my workouts. Sometimes it's a little less. Like this morning, I was really need to get it going, right? Got to get into work. And so try to think about that being more frequent and consistent throughout your week with your stretches versus doing longer bouts. So that's going to be my little tip for how to stretch. And I think that probably covered what I wanted to talk about stretching. Guys, let me know if you have any questions here. We're going to be wrapping up soon. I don't want this to be too long. And so dynamic warm-up, we're going to get that to you, Lori. Stephanie, we're going to get you the dynamic warm-up. Keith's getting the dynamic warm-up. Morgan's getting the dynamic warm-up. And Sundar says he started doing dynamic warm-up since last year and can see the benefits. Awesome, Sundar. Yeah, so that's great to hear. For those of you who don't know about dynamic warm-ups, definitely need to start stretching dynamically. I spend a lot less time doing static stretching than I used to. But if you guys also, I actually put together a great video collage, a 10-minute static stretching routine for all of your leg muscles. if you guys want that one I remember doing actually outside in front of my little garden area, summertime. I got back from a long run and felt inspired, like, hey, let's put this on video so I can share it with my clients. If you guys want the 10-minute stretch video, just type in 10-minute stretch video, and I'll drop you that link to the static stretches. Remember, after activity. All right, so we talked about types of stretching. We talked about when you should stretch. We talked about the frequency of how to stretch. And then honestly, I guess I'll go to my take-home point for stretching is that most runners feel that they need to do more stretching, and that's going to keep them healthy. There is no research at all that says that stretching reduces injury. Now, I'm not going to say that you shouldn't stretch in order to get yourself healthy, because I did include it in my 5 tips for healthy running, right? But however, if you notice, where was it in my hierarchy? It's 4th on the list. And it's 4th for a reason, because most runners think they should just be stretching in order to run, right? And that's what they should be doing for their exercise and keep themselves healthy. When in fact, most of the runners that I evaluate, treat, that I see with injuries, their main issue is strength, and it's muscle imbalances due to strength. So that's why that was tip number 1, strength training to run. Tip number 2, adding jump training, which is a form of strength training. Tip number 3, weight-bearing exercises and single leg exercises. Those 3 are far more important at keeping you healthy. So those of you that jumped on here today and told me about your IT band syndrome, I think that was you, Jess, right? And we talked about, I believe it was Keith says that the Graston, I didn't see that before. Keith worked wonders for his anterior tibialis strain. So yeah, the Graston technique, anterior tib, and also I like to do a little needle for that trigger point right in that muscle as well, Keith. So Doug was talking about his hamstring pain, right? So those issues and those conditions get better, much better with strengthening. And Doug, you want to be doing your eccentric hamstring exercises. That is the best thing that you can be doing for hamstring strains. All right. So if you want the eccentric hamstring video that I have showing you a nice progression of hamstring exercise, just type in hamstring exercise into the comment box. Or those of you that are watching on the replay and you've got some hamstring issues, you want to think about strengthening those hamstrings, adding load into the tissues in order to actually get it better. The other thing I must mention real quickly, guys, is this thing called eccentric strength training means slow lowering. So for the Nordic hamstring curl, where you're lowering your body, we call those like tree falls. You're kneeling and you're slowly lowering down, 5 or 10 seconds, slowly lowering down. That can be used for a couple of purposes. 1 is to strengthen the muscle. 2 is to actually add strength and resilience into the muscle belly and the tendon, which in Doug's case, in the proximal hamstring tendinopathy, that's going to get better, and that tendon is going to get stronger by doing this eccentric strength training. And then 3rd, it can actually improve your muscle length, believe it or not. And this is another thing that is very new in the research in the last 10 years. This is a new concept, guys, and I'm actually presenting it at our conference, talking about improving lat length in gymnasts who have really tight lats, or if you have shoulder pain and you're lifting in the gym. This used to be me all the time, get impingement, rotator cuff syndrome, tendonitis in my shoulder, but it's a muscle length issue with the lats. So if your lats, you can't reach overhead all the way because you got tight lats because you're always doing your pull downs and your rows, then there's a way to improve the muscle length of your lats. So we can do that through eccentric strength training. So not only can you do like your static stretches I talked about before and your dynamic stretches, but you can also do eccentrics for muscle lengthening. So very new concept, guys. You're not going to find that everywhere. It's a select few, even PTs, that know about this kind of newer concept and strengthening in order to improve muscle length. But that's a little like bonus tip I gave you here on this live. All right, guys, let's do a little recap here. What did we talk about today? We talked about what did we talk about? We talked about routine self-mobility and stretches, taking care of the soft tissue. We talked about some techniques that you might see a medical provider, whether it's a physical therapist, whether it's an acupuncturist, whether it's a medical doctor, a doctor of osteopathy, a DO, right? That might do dry needling. that might do acupuncture. We talked about instrument-assisted soft tissue mobilization. The other thing I didn't talk about, you could go to a massage therapist, right? And they're going to use their hands to get in and treat that soft tissue. And there's definitely a place for that as well. I know I had a fantastic massage right after the Disney half. That was amazing at the spa. And I highly recommend that, guys. That's something that I've never done in my life before. We did that for the first time when we went down to Disney in October for my 40th. And I was like, this is something I'm definitely doing every time I go on vacation, because that was something I highly recommend. And for those of you who have had a spa day, just type in spa, because that was the most amazing thing I've ever done in my life. And so we talked about some things that you can get done to you and your soft tissues that might benefit, especially if you have these soft tissue injuries that we talked about today, whether or not it's the glute medius, side of the hip pain, IT band syndrome, hamstring pain we talked about today, or if you have the all common Achilles issue or plantar fasciitis. These are all tools that can be done to help you with your pain. And then we talked about stretches. Static stretching versus dynamic stretching, when to stretch before, after your runs. We talked about foam rolling before that. Sorry, guys. We talked about foam rolling and doing when foam rolling has its place. And I honestly really thank all of you for participating in tonight's live. Thank you, Morgan. Thank you, Doug. Thank you, Jess. Thank you, Marva. Thank you, Sundar. Thank you, Keith. Thank you, Lori. Thank you, Stephanie. Thank you, Deb. And I think I pretty much got most of the people who jumped on here. Stephanie, I think I said, and I apologize if I did forget you, but thank you so much for jumping on here on the live. If anything I said tonight, guys, resonated with you, just hit that little like, hit the heart. Give me a little hearts today. Need it. It's been a long, long day. Started out with my 4-mile run at 5 o'clock. Yeah, that was 5 a.m. with a little workout, and then teaching a bunch of meetings today, then helped out a bunch of folks, got them moving. We've had some really good successes today. So today was a great day. And I even still had the energy to come on here with you because you guys pumped me up. I love interacting with you guys, and I love being able to help more of you runners out and to keep you healthy, share these strategies with you. I'm all about kind of this abundance mindset and sharing with each of you. So thank you so much for jumping on, and thank you for those that watch us on the replay or watch us on our YouTube channel. I appreciate you guys. Thanks for following along. I hope this stuff is helpful for you. If it was helpful, just type it into the comment box. Just type in helpful. So just so I know like what you guys want to hear about. Make sure, don't miss, next week we're going to close out our 5 tips for healthy running, or our Spark Blueprint, and really talk about training. So we're going to get into kind of training, proper training progression, being smart with your training. Don't miss that. It's going to be, I think, really going to be the first time. We've done another one on training, but I think this one will kind of put it all together, hopefully. And again, this will kind of keep you active and healthy. And those of you who are interested in taking your training to the next level, you got to check out the Spark half marathon program that we're doing for the Cheshire half marathon. It's on their website. They put it on today. So if you go to just Google Cheshire half marathon, or if you Google Cheshire half marathon Spark, you're going to see the landing page for that and description of the full program. But I'm going to drop it in the comment box right now. Right when I get off, I'll drop that link in there so you guys can check it out. I want as many healthy runners in this program as possible. Trust me, it's going to be fire. It's going to be exciting. We're going to keep you motivated, accountable with you every step of the way during this 10 weeks. It's going to be something that I've never done before, but it's, like I said, it's going to be a little beta test. And I got big plans for 2020, 2021. So this is going to be, the cheapest that we're ever going to do a program like this that's going to be this comprehensive. So get in now so you can reap the benefits. I would love to see as many of you in this program as possible. So as always, guys, stay active, stay healthy, and just keep running, because that's what we do, right? Stay healthy. So thanks again, guys. Thanks for watching. And until next time, bye.